Hi, my name is Melanie Correa. I'm a nursing student. Can you confirm your name and date of birth for me, please? Alright, and what can I call you today? My pronouns are she, hers. What are yours? And do you have any allergies? Alright, thank you. So I'll be performing a musculoskeletal assessment. I'm going to start by palpating and inspecting all of the joints. I'll be inspecting for redness, swelling, nodules, and deformities, and I'll be palpating for swelling, increased warmth, crepitus, and tenderness. So I'm going to start with the neck, palpating and inspecting for all of those signs. Then I'll move on to the shoulders. Then I'll palpate and inspect each of the each of the elbows. Then I'll move on to the wrists. I'll palpate and inspect each of them. Then I'll palpate and inspect all of the finger joints on each hand and each of the thumbs. Then I'll move on to the hip. I'll palpate and inspect that joint and then the knee joints of each leg. And then I'll do the same for the ankles. I'll palpate and inspect each of them. I have my shoes off. The patient would have their shoes and socks off. I'll palpate and inspect their toes. And then lastly, I'm going to palpate and inspect their spine. So with them standing up, I'll check for signs of deformity, and I'll check for symmetry, and I will palpate their spinous process. Alright, then I would move on to range of motion exercises. So I would first test the patient's neck by having them perform flexion by bringing their chin to their chest, then extension by looking up at the ceiling, lateral bending by bringing their ear to each shoulder, and rotation by looking over each shoulder. Then I would test their shoulders by having them perform flexion by bringing their arms out in front of them, extension by bringing their arms out behind them, abduction by bringing their arms out to the side and overhead, and then adduction by bringing them back down and across their body. Then for external rotation, I would have them put one hand behind their neck like they're brushing their hair. And for internal rotation, I would have them touch the opposite shoulder blade behind their back. Then for the elbow joint, I would have them put their arms out and bend at the elbow to demonstrate flexion, and then straighten their arms to demonstrate extension. Then I would have them perform supination by, with their arms out, turning their palms up as if they're carrying a bowl, and then turning their palms back down so they face the floor to demonstrate pronation. Then for the wrists, I would have them point their fingers down to the floor with their arms out, and then point their fingers up towards the ceiling to demonstrate extension. For radial deviation, I would have them point their fingers towards the midline of their body, and then for ulnar deviation, I would have them point them away from the midline of their body. For their fingers, I would have them make two fists to demonstrate flexion, extend their fingers out to demonstrate extension, spread their fingers to demonstrate adduction, and bring them back together to demonstrate adduction. For their thumbs, I would have them touch their thumbs to the base of their pinky to demonstrate flexion, and move their thumb back out to demonstrate extension. For opposition, I would have them touch each of their fingertips with their thumb, and then for abduction and adduction, I would have them put their palms out towards the ceiling, move their thumb up towards the ceiling for abduction, and back down for adduction. Then I would move on to the hips. So the patient would be lying on a table, and I'll demonstrate what they'll do. I'll start with and then in a prone position to demonstrate extension. So with the patient lying prone, they would bend at the knee and lift their leg off the table. And then with the patient in the supine position, they would bend at the knee, and bring their knee towards their chest to demonstrate flexion at the hip. For abduction, they would move their leg away from their body, one leg at a time. And for adduction, they would just bring their leg back towards their body. For internal rotation, they would bend at their knee and move their leg so that their heel is facing away from their body. And for external rotation, I would have them move so that their heel is crossing over their opposite leg. Then for their knees, they could stand back up, and I would have them perform flexion by squatting down, extension by straightening their legs and standing back up. And then for their ankles, I would have them perform flexion by pointing their toes down, extension by pointing them up towards the ceiling. So flexion down, extension up towards the ceiling. For inversion, I would have them point their heel towards the middle of their body, towards the midline. And for eversion, I would have them point their heel outwards. Then for their toes, I would have them perform flexion by curling their toes, and extension by straightening their toes. And then for the spine, I would have them perform flexion by trying to touch their toes, extension by standing back up and then leaning backwards as far as they can as I use one hand to stabilize them. I would have them perform lateral bending by bending side to side as I have my hands on their hips to stabilize them, and then rotation by them turning side to side as I stabilize them. And then I would just move on to strength exercises. So I would, strength tests, so I would start with their shoulders. I would have them move their arms out with their thumbs facing down. I'm just going to double check this. So I'm pushing down as they are resisting. So I would do this with each arm. And then the next thing I would do is have them try to push out as I am resisting. And then for their elbows, I would have them try to flex their elbow and keep their elbow flexed as I am resisting. I am pushing down, trying to straighten their elbow. And then I would have them try to extend as I am resisting by pushing up on their arm. For their wrists, I would have them make 2 fists, and I would push down on their fists as they try to resist me. And I would perform the finger grip test, where they grab 2 of my fingers, 1 in each hand, as tightly as they can, and I will try to pull away. Then I would move on to the hips. So again, with the patient lying on the floor, they would have their legs out in front of them, and with one leg off the table, they will try to keep their leg flexed as I am pushing down, and then I will test that for both sides, and then after that, with one leg underneath their thigh, they will try to extend their leg as I am resisting that movement. Then for their knee, they would flex so that their knee is up, and I will put one hand on top of their leg and try to straighten out their knee as they try to keep their knee flexed. And then they will try to extend at the knee as I have one hand underneath their leg resisting that. And then lastly, for their ankles, they would try to perform extension. So they would first try to perform flexion by pointing their toes, and I will have one hand underneath their foot to resist that. And then they will try to perform an extension by trying to move their toes upwards, pointing at them, as I have one hand on top of their foot, resisting that movement. And that's everything.